So here's our patient. She is a 50-year-old woman who does not like the extra skin of her tummy. She's had a baby in the past and her tummy has gotten quite a bit stretched out. So we're going to perform a tummy tuck today to get rid of all that excess skin. We're going to tighten up her underlying muscle and we're going to do a little bit of liposuction out here and here. Let me take you into the OR and I'll show you her markings. All right, here are our markings for surgery today. We are going to try to remove a lot of extra skin from her. She's going to have an incision from hip to hip. The goal is to lift everything all the way up here. We're going to tighten up her muscles on the inside, hoping to take out all of the skin or as much of it as possible. And we'll do a bit of liposuction on her hips as well. So we'll get started and I'll show you how she looks when we are all done. All right, we're all done. Everything went great. We were able to remove pretty much all that skin I'd marked, so real happy with that. She does have a scar that's going to go from hip to hip. These little wrinkles are going to go away. Did some lipo as well. Let me show you her belly button. This is really interesting. She has actually two little belly buttons inside, so hopefully you can see it. Kind of odd, maybe from her previous surgeries. Now let me show you the skin we took off. Okay, so this is all the skin that we've taken off of her. You can see a lot. You can see her old stretch marks. This is where we did the lipo through, and her belly button used to be up here. So pretty impressive, and we'll show you how she looks when she's healed. We are now 6 weeks after her surgery, and she is healing beautifully. Let me just get in close. You can see there's a little scar around her belly button, and at 6 weeks it's healing really well. It's going to heal even better. There's a scar, and it's hip to hip, but I can show you here how it's underneath her underwear, and that's the great thing about it. I'm real happy to see she's starting to contour in, and you can see some of the definition come through. She's got a little bit of a line coming straight down the middle. So, and being just at 6 weeks, she's still swollen, and I'm real excited to see how she's going to look here in just a few months. So I hope you liked watching that result. A few keys and some information just for you if you're thinking about a tummy tuck. So scars, there are permanent scars from a tummy tuck. And the scars do heal, they do tend to fade with time, but not necessarily in everybody. So the scar is typically a hip-to-hip scar, and there's a little scar around the belly button as well. Now this patient is about 7 weeks out of surgery, and we usually have them start exercising at 3 weeks, although I ask her to wait 3 months to start working out her abdomen, okay? And so crunches, sit-ups, yoga, Pilates, that she'll start at about 3 months. And the final thing is swelling. Swelling can take 4 to 6 months to completely go away. So the result that you're seeing in this 7-week result, it's gonna look a lot better actually as the months go by. And it really does take that 4 to 6 months to finish off. Well, if you've enjoyed watching this tummy tuck, take a look at this other one right here.